Thank you for joining us today for the Centers for Medicare and Medicaid Services Office of Minority Health Minority Research Grant Program Application Assistance webinar. My name is Jessica Dawson, and I'm a Black woman with box braids, a pink blouse, and a black blazer. We're so pleased to have you join us today. Before we dive into today's webinar, I would first like to share the purpose of this webinar. The Minority Research Grant Program's Application Assistance webinar sessions are designed to provide additional assistance by providing background information as well as firsthand experience from current and previous grantees and answer any questions you might have. We hope that today's session will help you get more familiar with our program, especially as you consider whether your institution would like to apply. Next slide, please. Today's session will begin with an overview of the Minority Research Grant Program, followed by details on the 2024 Notice of Funding Opportunity, including eligibility requirements and how to apply via the grants.gov website. Following these items, we will conclude with time for questions from the audience. On this slide, we also have instructions regarding accessibility for today's event. To access the live transcript feature, go to the menu at the bottom of the screen and click the live transcript icon. After you click the icon, click on View Full Transcript, which will allow closed captioning to appear on the bottom of your screen. And the transcript will show on the right-hand side of your screen. Next slide, please. So as many of you most likely know, CMS is the largest provider of health insurance in the United States and responsible for ensuring more than 170 million individuals supported by CMS programs and can get the health care and health coverage that they need and deserve. The Centers for Medicare and Medicaid Services Office of Minority Health is one of 8 offices of minority health within the United States Department of Health and Human Services. We work with local and federal partners to eliminate health disparities while improving the health of all minority populations. Next slide, please. Next, I'll be providing a brief overview of the Minority Research Grant Program. Next slide. Thank you. The Minority Research Grant Program, also referred to as MRGP, is administered by CMS OMH to support researchers at minority-serving institutions that explore how CMS can better meet healthcare needs of the populations that we serve, including people from racial and ethnic minority populations, LGBTQ+ persons, persons with disabilities, persons with limited English proficiency, persons who live in rural areas, and persons who otherwise are adversely affected by persistent poverty or inequality. Additionally, the MRGP supports CMS's efforts to advance health equity by increasing the understanding and awareness of health disparities, developing and disseminating solutions, and implementing sustainable actions. Next slide, please. For the last 2 decades, CMS has provided MRGP grantees with funds to further health equity research that supports researchers pursuing topics that impact minority populations, investigates the root cause of health disparities, and fosters the dissemination of grantee research within CMS's programs. The grant program gives our communities the opportunity to benefit from research as well as fantastic opportunities to help minority-serving institutions and health equity researchers grow their work and the portfolio. Next slide, please. And at this time, we will watch a short video highlighting the MRGP. This video has been updated to include a few new minority-serving institutions that are eligible to apply for this year.
The Minority Research Grant Program helps researchers at minority-serving institutions like yours build a portfolio while funding studies that are important to the healthcare needs of people who are medically underserved across the nation. As a grantee, you can investigate the root causes of health disparities, share best practices for reducing these disparities, and improve the health of all minority populations, including racial and ethnic communities, people with limited English proficiency, lesbian, gay, bisexual, transgender, and queer or LGBTQ+ persons, persons with disabilities, persons who live in rural areas, and persons otherwise adversely affected by persistent poverty or inequality. Becoming a grantee allows you to partner with the Centers for Medicare and Medicaid Services, grow your research credentials, increase the public's knowledge on health equity, and share your findings to join the ranks of other Minority Research Grant Program awardees who have published dozens of manuscripts that have been widely cited. For over 2 decades, Minority Research Grant Program awardees have uncovered health equity barriers and solutions in the U.S. by addressing a variety of issues in chronic conditions and healthcare access. The Minority Research Grant Program strengthens the capacity of historically Black colleges and universities, Hispanic-serving institutions, tribal colleges and universities, Asian American and Native American Pacific Islander-serving institutions, Native American-serving non-tribal institutions, Alaska Native and Native Hawaiian-serving institutions, and predominantly Black institutions. The MRGP also helps widen the pipeline of researchers making a difference in disparities affecting minority healthcare. To learn more about the Minority Research Grant Program, eligibility requirements, and how to apply, visit go.cms.gov/minorityresearch.
Thank you for sharing the video. We do hope that you found the video useful. It is also available on our YouTube page, and you can access it at any time that you would like. And I will now turn it over to our next speaker, our MRGP lead and resident expert on all things MRGP, Brian Young from the CMS Office of Minority Health. Brian will start with a review of the goals of MRGP.
Thank you, Jessica. Hello, everyone. My name is Brian Young. I am a public health advisor within the CMS Office of Minority Health. I am a Black man with locks, and I am wearing a gray sweater. Through the Minority Research Grant Program, we've set out to achieve several goals. The first is to develop capacity at minority-serving institutions to research health disparities and social determinants of health. This support for minority researchers helped them grow to a point where they can conduct research independently and be competitive for other grant support. Next slide, please. The second goal aims to understand the root cause of issues that lead to health disparities and identify repeated interventions. Institutions investigate these root causes by exploring local conditions and populations, specifically medically underserved populations. Next slide, please. And lastly, the research funded by the MRGP uses various methods to broadly disseminate best practices for addressing health disparities, providing culturally competent care for all patients. CMS reviews these findings and best practices to strengthen CMS programs. Next slide, please. So I'd like to share a few summary highlights from the 58 grantees funded between 2005 and 2022 MRGP cycles, so you can better understand the impact MRGP has had on the grantees and that the grantees' research has had in communities. The MRGP has funded a range of projects focusing on various populations that experience health disparities. Grantees from historically Black colleges and universities and Hispanic-serving institutions have focused on health disparities affecting African Americans and Hispanics, respectively. Through research efforts from the funded grantees, we were able to see the impact MRGP has had. Many of the grantees reported disseminating their findings academically, through peer-reviewed journals and at conferences, as well as to the communities they have collaborated with during their research. The Minority Research Grant Program is an opportunity for health equity researchers to not only expand their research efforts, but also disseminate their findings through diverse methods. Next slide, please. So we have funded health equity researchers at minority-serving institutions through the MRGP for 2 decades. This slide shows our 2023 grantees: Morgan State University, University of New Mexico Health Services Center, and California State University San Marcos Corporation, who have all examined critical public health disparities. Next slide, please. So I would like to turn to sharing a few learnings from previous grantees related to their experiences with the MRGP application process and their overall experiences within the program. 2 of our previous grantees from Meharry Medical College and Texas Southern University shared their experiences with us last year that we thought would be helpful for you as you are considering applying for the grant. Our Texas Southern University grantee shared that planning ahead of time, working collaboratively with their team at the university, and communicating as much as possible with their university's Office of Research around timing and due dates was extremely important in the success of completing their MRGP application on time. There were multiple rounds of review and signatures needed from authorized signing officials, so they made sure to communicate these details with all involved parties to ensure a timely submission. The Texas Southern University grantee also noted the importance of receiving as many letters of support as possible from collaborators, and to think through the type of letters of support you may need. For example, a general letter of support from community members compared to a letter of intent to establish a consortium. A letter of intent may be helpful if there are funds moving in between your home institution to another institution. Even if you are unable to secure a high number of letters of support, they still recommended sharing this intent within your application. This can show you are intentional in bringing your work back to the community or your target population and may strengthen your submission. Our Meharry Medical College grantee mentioned they experienced clear, concise, and easy-to-follow instructions and quickly found necessary dates and contact persons when preparing to apply for the grant. They specifically spoke about having a mentor who previously applied for the MRGP extremely valuable. This helped them receive targeted guidance and mentorship while collaborating on completing their grant submission. When it came to their overall MRGP experience, these grantees also shared some useful tips. Our Texas Southern University grantee highlighted some challenges when she learned her data source, a hospital's electronic medical records, transitioned to a new medical record system. This led to the data being inaccessible, which was very likely to impact the funding and implementation of their study. Our Texas Southern University grantee also noted initiating open communication with us at CMS OMH seeking guidance to make modifications to their study's timeline and requesting a no-cost extension to ensure they could access data from the hospital's registry. With our recommendations, collaborations, and support together with Texas Southern University, they successfully streamlined the timeline to fit when they would be able to access the necessary data and were able to receive a no-cost extension. Texas Southern University also shared their ability to network across multiple levels, including community members, stakeholders, elected officials, and various funding agencies, for example, CMS and one of our partner agencies, HRSA, during their funding period. Even after the timing of their grant ended, these relationships allowed Texas Southern University to continue working towards their area of study, reducing health disparities for prostate cancer among African American men. Our Meharry Medical College grantee emphasized the importance of funding support. They ensured this delicate part of the award process was handled with care. For example, they ensured approximately half of the funding was dedicated to salaries for those working on the grant, and other small portions were allocated for items such as community navigators, participant incentives, equipment, travel, and a sub-award with a health center. This grantee also shared a few reasons why they believe their experience within MRGP was beneficial. From a research perspective, they were able to get nearly half of their target population educated on their research health topic, prostate cancer, and perform the desired health behavior, get screened for prostate cancer. From a programmatic perspective, our Meharry grantee gained additional experience developing a grant and met other researchers with whom they could collaborate with in the future. They were also able to include students to participate in the grant, and they were able to gain additional research and work experience. We hope you found these learnings helpful. We do have time for a Q&A session in a few minutes. where we are happy to answer any questions you may have after hearing these experiences. So we look forward to discussing more at that time. Next slide, please. So we will now review MRGP's Notice of Funding Opportunity. Next slide, please. So I am very excited to share that on April 1, 2024, CMS OMH released the 2024 Minority Research Grant Program, a Notice of Funding Opportunity. We are now accepting applications via grants.gov, and the deadline to submit is Monday, June 3rd. This year, we plan to award up to 5 grantees of up to $255,000 each, totaling $1.275 million to eligible institutions. Next slide, please. So now, before we provide a demonstration on how to properly submit an application through grants.gov, I would like to go over some eligibility requirements. Next slide, please. Applications undergo a thorough review process, evaluating the level of innovation, community collaboration, and scientific rigor. To be eligible, researchers should focus on developing suitable interventions for health disparities impacting minority populations. Health equity researchers with suitable projects from the following types of minority-serving institutions may apply: historically Black colleges and universities, Hispanic-serving institutions, tribal colleges and universities, Asian American and Native American Pacific Islanders serving institutions, Native American serving non-tribal institutions, Alaska Native and Native Hawaiians serving institutions, and predominantly Black institutions. For more information on eligibility requirements, you can visit the program's website listed on the screen. Next slide, please. So next, we will provide a demonstration on how to properly submit an application through grants.gov. Next slide, please. So when you visit grants.gov, the first thing you will need to do is click on Search Grants tab. Next, you will type the MRGP grant number into the opportunity number box and click Search. Make sure you include the dashes as they are part of the grant number. Next slide, please. So once you've clicked Search, the MRGP grant number will appear and you will proceed by clicking on the actual grant number. Finally, the Minority Research Grant Opportunity Number will appear, providing more information such as the grant synopsis and eligibility requirements. Once you have completely read all of the MRGP requirements, you will proceed by clicking Apply. Next slide, please. We will now move to the question and answer portion of the meeting. You can submit your questions using the Q&A feature. We will answer as many questions as time allows. Let's see. So the first question: are subcontractors, collaborators from another non-minority serving institution allowed to be included in the budget if the PI is based at a minority serving institution? So let me see. So that's up to the PI. So the PI from the eligible institution must submit the application. So if you talk to the PI and they allow you to be in the part of the budget, then that's totally fine. Slides will be available after this meeting in a couple of days. They should be on our OMH website. There is a requirement of 1% cost sharing by a third party. Can the third party be participating in the application? So as long as the PI is okay with you being in the application process, that is totally fine. I have a company that is not on your list of eligibilities. However, we are looking to improve how the divorce process impacts. No, unfortunately, you must be one of the eligible institutions that I talked about a couple of minutes ago. If you would like to partner with one of the minority serving institutions, that is a possibility, but the minority serving institution must submit the application. What is the length, formatting requirements of the application? I would suggest you to go to grants.gov and search the MRGP, and you'll have all the information right there. Hi, I am in an Hispanic serving institution. I am not a citizen and I don't have a green card yet. Can I apply for the grant as the PI? So I think that you sent me an email. So I'm going to get back to you about that part, but I think it's okay. But let me talk to a grant specialist to confirm, and I will reply to your reply back to your email. So we provide prenatal, maternal health, and healthcare deserts that serve Hispanic and African American populations. Are you one of the colleges, Dawn? Are you part of one of the colleges that are one of the 7 colleges that I talked about a couple of minutes ago? Because if not, you will have to collaborate with one of those colleges in order to participate. So you're suggesting I'm finding. So Sabina, send me an email. I will show you the email at the end, and then I can try to get you in contact with one of our grantees to see if they can help. The same for the anonymous attendees. Send us an email, and I'll see if I can get you in contact with one of our previous grantees. So Dawn, you said you're a provider. Yeah, I would recommend you talking to one of the minority serving institutions to see if you all can collaborate. And if you all can collaborate, they'll send the application and take it from there. So can the MSI partner with a hospital system? And if so, what arrangement should it be? You can partner with the hospital system. That is totally fine. And then the arrangement is up to you all. So the grant is it's offered yearly. So can the funds be used for faculty professional development? That would be something you would put in the application. That would be something we would review. So someone asked how many applications you would usually get each year. That's something that we can't share, unfortunately. Yeah, so it's grants.gov. You typed in grant.gov. What can we use the grant for? Especially if we do secondary data analysis, can we use it to buy out courses? No, you can't use it to purchase courses. You would the money is for research. I think I answered this one about the 1% cost sharing.
No, Brian, I think the grants.gov webpage is having some issues today, isn't it?
Oh, okay. I'm like, because that is the website.
Either earlier. Yeah.
I just pulled it up. Yep, they both work.
Oh, never mind. I was able to pull it up. This morning it wasn't working. So
No, it's okay. That's what I mean is for a lot of us at minority serving institutions, the teaching load is very heavy. Buying out courses, giving us course releases, yes, that's not allowed with this screen, unfortunately. I think the indirect percentage, I think it's 1%. Are cloud computing costs, for example, at all of us researcher workbench allowable for research costs? I honestly don't know what that is. Ashley, are you on the line?
I am here, yeah. I'm reading it. It's our cloud computing costs, for example, at all of us researcher workbench allowable for research costs. I think, is that implicating like a computer software system? Is that maybe what we're getting at? Some sort of I think it's getting at like the cost of some sort of software. Would that be something that would be allowed as part of the grant cost?
So if it's part of your research, if you need it in order to do your research, then that would be an allowable cost.
Yeah, so it's just, I mean, a lot of high throughput computing is moving to cloud-based computing, and I'm still learning, exactly how to fund that part of my research. So all of us is, NIH is big data.
Mm-hmm.
Million, trying to capture 1 million underrepresented individuals, sequence their genomes, and collect all their health information. So it's just a good resource for this kind of research. And I just wanted to know if you'd had any experience, I guess, with funding those kinds of analyses. Okay, thank you.
You're welcome. So is it possible to include PI's time on the grant? This could be during the summer or release time during the academic year. What do you mean? Taza, you are correct. Yes, the same. I'm not sure about the PI's time on the grant question. So RFP mentioned to coordinate with CMS OMH to determine if questions used to collect data align with standardized social determinants of health questions. Do you have the web link or contact person for further information? Ashley, is that on our website, the standardized questions?
The standardized, yeah, we do have some of that. Let's see. Let me see what I can pull up real quick for folks. Give me 1 second. Are we thinking the Z codes ones? Is that? Thinking that might be it. But you know what? You can also feel free to send us an email to that OMH grants. And we can just double check that as well. That might be the best answer.
Any other questions? Let's see.
There's a question about the funding period after receiving an award.
So the funding period this year will be from September 29th, 2024 to September 29th, 2026. So it'll be a whole 2 years. So while the PI is conducting the research, can the grant be charged for some of this effort? This could be during the academic year or during the summer. It might be 10% during the... Yeah, that's totally fine. That's up to you all, and you will write that into your in your application on how you would like to allot the funding. So for this cost sharing and indirect cost percentage, please send us an email because we need a grants professional to answer that one. Because I understand a little bit, but I don't want to give you the wrong information. So you send it to me and I'll send it to them. Any other questions? The dates are September 29th, 2024 through September 29th, 2026. You said HRSN survey. I'm not sure what that one is. Let me Google it really quick to see. There's something here on OMH.
The health-related social survey, but not sure. No.
I'm trying to see which component that would be in. So send me an email about that one as well, because that one is in-house in OMH, but I can find someone that may be Medicare to help with that question. No, the 1.275 is the overall total. So we would divide that by 5. So you would get 255,000. So it looks like there aren't any more questions. So let me go back to the slides. So thank you, everyone, for your questions. We hope you've learned more about the Minority Research Grant Program and feel more prepared to submit your application by Monday, June 3rd. So next slide, please.
Oh, sorry, Ryan.
You're good.
Now, listed on the slide is our contact information. Thank you all for spending time with us here today. We have several mailboxes listed here, with the main one being our OMH grants at cms.hhs.gov. We encourage you to visit our website at go.cms.gov/OMH and sign up for our listserv so you can stay up to date on all of our health equity-related initiatives. We want to thank you all again for joining us today. We hope this session was helpful in helping you better understand the Minority Research Grant Program and encourage you to explore it for your institution. And with that, have a great afternoon and thank you for joining us today.
Thank you all.